Hello, I'm Elaine Sterling, and welcome to the Introduction to Microneedling. I'm Elaine Sterling. I'm a licensed esthetician, a licensed esthetician instructor. I have my Sedesco diplomat as well as ITEC diploma. Today we're going to talk about microneedling. So right off the bat, I always like to let estheticians know. The first thing you need to do is check with your state licensing body. And does microneedling fall under your scope of practice? I know there are many estheticians that are performing microneedling procedures. I feel that microneedling should only be done under a doctor's license, under the right medical insurance. But again, it all depends on what state you're in. And if you're not sure, you could always contact your licensing board and the medical board and make sure that your professional liability insurance covers you for microneedling. Today, we're going to discuss the history of microneedling, the benefits of microneedling, contraindications and the importance of client consent, pre and post care defined, understanding needle depth, and treatment protocols. So, microneedling may be thought of as a new aesthetic procedure, but actually it goes back thousands of years. First of all, if you think of acupuncture, that was really the first form of microneedling in the skin to really achieve vital energy or life force flow. Nowadays, acupuncture is used to improve the body's functions and promote natural self-healing process, which is actually what microneedling did. But the first recorded use of microneedling procedure was in 1905 by a German dermatologist, Ernest Kromeyer. He used various size dental burrs powered by a motor-driven flexible cord equipment to treat scars, birthmarks, and hyperpigmentation. Microneedling, as we think of it today, was first used in 1995 by Dr. Desmond Fernandez for the treatment of wrinkles and scars with the use of hypodermic needles and small needle stamps to induce collagen production. So this later led to the development of our modern microneedling devices. And there are many devices that we'll go over in this lecture today. So I want to talk about needle depth. I also believe as estheticians, we are working in the epidermis. So if you have a look at where the epidermis is on the slide and where the dermis is, so your 1.5 to 2 millimeters is definitely going into the dermis. Your 0.25 to 1 millimeter is really going just to that papillary dermis. So I feel this slide really shows you how you can dial that needle depth. Remember, the skin is, of course, thinner on the forehead and around the eyes and more sensitive on the upper lip. So you're able to really target the depth of the needle and trigger because your 1.5 to 2 millimeter depth is to reach the deep dermis where there are scars, all right? And then your 0.25 to 1 millimeter needle depth is to reach the epidermis or the papillary dermis, which is the upper epidermis for the fine lines and pores. Now, I will tell you that even a light depth of 0.25 to 1 millimeter is triggering the dermis to build collagen and elastin. So what we call CIT, collagen induction therapy, where we microneedle the surface of the skin to break up old collagen strands and stimulate the production of elastin fibers, restoring a smoother appearance. Because if you think about, we want a plump and juicy dermis with a beautiful smooth epidermis. So we're trying to trigger collagen and elastin to reproduce. Devices. There are many types of devices. Of course, you all know about the rollers. I think that's where we all started. There also, you'll see a lot of rollers that are sold for home use, and those are going to be not penetrate the dermis at all. Those are just going to basically stimulate the skin and help the serums penetrate. You do get rollers that go into the dermis as well. You get stamps, pens, and then of course you have seen recently combined with radio frequency. And I'm sure you've all heard of vampire facials or PRP facials, protein-rich plasma facials, which really help stimulate the skin as well. So what does microneedling help? What are the benefits? So of course, fine lines and wrinkles, scarring, acne, reduce the appearance of enlarged pores, thinning hair or hair loss. It does stimulate the production of hair. Okay, so even if you're doing it on the face, it can stimulate the production of hair. But this is fabulous for people that have hair loss, um, where you can stimulate hair growth on the hairline and in the hair. And there are hair serums that you can purchase and you can use that are designed to combine with microneedling. So that's a whole practice on its own that you could have in your center. Skin pigmentation issues, stretch marks, loose skin, such as after weight loss or liposuction. What are the risks? I would say there aren't that many risks because it's almost like think of when you prick the skin, right? It tends to heal very quickly. And also think about when you're aerating a lawn. You're aerating a lawn and you're putting punctures in that grass, but there's healthy grass around the puncture. So you're injuring the skin, but there's healthy tissue around that injured skin. So the healing process is so much quicker. And I would say start with that, not that deep depth, right? See how the skin reacts. What are some of the risks? Swelling, discomfort at the site, redness, bruising, dryness, flaking of the skin. Bleeding is an uncommon reaction to microneedling, though it may be more likely to occur after a deeper treatment. Some further complications. Bleeding may also be more of a risk for people who have bleeding disorders who are taking blood thinner medications. It is important to disclose this information to a doctor before receiving this treatment. There is also a risk of more serious side effects, including infection, skin pigment changes, reaction to topical medications used during the treatment. So I would say always take a thorough intake form. Find out what they're using at home in their skincare. See if you think that they should be stopping their vitamin A, retinoids, tretinoins, their AHA, BHAs, pre and post care. Make sure that they do not have an immunocompromised system because we are triggering the skin to heal itself. So we are really looking for an intact epidermis and a healthy person that does not have any contraindications that may inhibit their healing process. Some contraindications are skin infections, active acne, very pustular acne. We don't want to break open those pustules. We don't want to spread bacteria, nor do we want to, spread bacteria, cause scarring, hyperpigmentation, or post-inflammatory hyperpigmentation. Eczema, herpes simplex, blood clotting conditions, active bacterial and fungal conditions, immunosuppression, not recommended for women who are pregnant or nursing. Micro injuries. Mechanical remodeling of the skin using a medical microneedle penetrates the correct depth. Remember we talked about that, either into the epidermis, that's 0.5 to 1 millimeter, or down deeper into the dermis for the thicker parts of the face, or for deeper work on scars, depending on the skin condition, in order to reach the dermis and stimulate the production of collagen, elastin, and hyaluronic acid. The treatment works by causing controlled microinjuries, which stimulates a healing response in the body. Microneedling is a device with multiple tiny sterile needles that are pushed in and out of the skin, causing tiny punctures. Think of your sewing machine, in and out, but with lots of little needles, either punching or needling or rolling that skin like it's aerating the lawn. The body then repairs these tiny punctures by producing new collagen. After the treatment, patients should leave the blood on their face for at least 1 hour. Blood contains many useful growth factors and anti-aging boosters. The channels that are open following microneedling are only open temporarily, so we want the blood to absorb as effectively as possible. So the microneedling is leaving those channels open so that your serums that are designed for microneedling can penetrate into the skin. You also need a slip and glide for the microneedling on the skin. So a hyaluronic acid that's designed for microneedling, that'll help the microneedling pen move along the skin, is very useful. Make sure that you use serums that are recommended and designed, or PRP serums for microneedling specifically. Wounding and repair. Microneedling triggers the skin and immune system response. The increased blood flow assists in the creation of new tissue. Proliferation. The wound is rebuilt with granular cells and new network of blood vessels. It remodels. The wounded areas were replaced with new dermal tissue and rebuilt with granular tissue. So think about you're building collagen and elastin, you're wounding the skin, the dermis is triggered to heal that wound. Fibroblast, the principal active cell of connective tissue. Fibroblasts are large, flat, elongated, spindle-shaped cells possessing processes extended out of the ends of the cell body. The cell nucleus is flat and oval. Fibroblasts produce tropocollagen, which is the forerunner of collagen, and the ground substance and amorphous gel-like mattress that fills the spaces between the cells and the fibers in the connective tissue. Collagen remodeling. New collagen production forms after 14 to 15 days. This process continues through days 20 to 21. The new skin integrity lasts for several weeks to several months. Collagen production normally peaks after 6 months. So what is this slide telling you? This slide is telling you that collagen and elastin is being produced, collagen production, well after when you stop the microneedling, right? So we're forming at 14 to 15 days, continues through day 20 to 21, and then several weeks to several months after that. So if you're doing it in a series, every month for a lighter depth, or every 6 weeks or every 3 months, you really are building a lot of collagen. And there's very few things that we have in our toolbox, few modalities that can really build collagen like microneedling can. Collagen. Collagen refers to a family of proteins that are the primary structural component of connective tissues, such as skin and cartilage. About 90% of the collagen in the body is type 1, which is found in the skin. There are many different types of collagen, 16 to be exact. Type 1 collagen is used for strong hair, skin, nails, and bones. Type 3 is used for the same. While type 2 collagen is less prevalent within our bodies, it still offers great benefit to the aging body by promoting joint and cartilage health. Depth of penetration. So we talked a little bit about this, right? The home derma roller, remember the one that I talked about that you buy over the counter, is about a 0.2 millimeter and a 0.3 millimeter model are specifically designed not to penetrate and not to cause pain. So no topical anesthetic is needed, and it's great for the client to have that at home in between their microneedling to stimulate the skin and to help with their product penetration to use with serums, etc. In the treatment room, longer needles, 1.0 millimeters to 1.5 to 2 millimeter and 3 millimeter, can cause pain, but also produce a very good result and may need topical anesthetic to numb the area treated. Numbing makes the procedure more comfortable. Normally, to numb, this is a 4% lidocaine or other anesthetic creams applied 45 minutes before the procedure. So here's the thing about microneedling. When you're doing microneedling and they're going to have the numbing on, they're going to have to come 30 minutes prior. So you can put the numbing on, and then you could massage their décolleté and hands because they're waiting 30 minutes. You could also use a jade roller to kind of roll over the numbing. So there's things that you could be doing during that time, right? If you're staying under 1, you probably won't need numbing. But like I said to you, the forehead is very thin around the eyes, around the orbital area, and the upper lip tends to be sensitive. Obviously, the cheeks are a little fatter, so they tend to be not as sensitive. If you look at how you do microneedling, think of microdermabrasion, where you're creating that cross hatch, and you can also do little circles as well. So here's a guide on this reference chart that just shows you how many millimeters roughly you would be doing on certain areas of the face. For example, the forehead. Remember I said the forehead was a little thinner, so 0.25 to 0.5. On a thicker skin, you could go a little deeper. So this is just a nice guide. But honestly, once you start doing microneedling, you really don't need this chart because you kind of understand a thinner areas under 1, thicker areas over 1. Inflammatory responses. Microneedling on active acne may result in the spread of acne and infection, can worsen rosacea, and without correct skincare can aggravate melasma. So we really need to make sure that this client is a candidate for microneedling. And I always say in aesthetics, 1 foot on the gas, 1 foot on the brake. Maybe keep it under 1 for their first one to see how the skin behaves during the treatment and how the skin behaves after the treatment. And then maybe if they're on a series, you can increase that as you see the tissue response. And there will be erythema on the skin. The skin will be tight, and I always tell the client your skin's going to feel thirsty. Side effects experienced with the skin needling are very minimal and usually subside within 24 hours. They do include redness, stinging, itching, tightness, and perhaps even slight peeling. Results. Visible results of skin rejuvenation are seen after just 6 to 8 weeks following the procedure and continue over the following months up to a year. A course of 3 skin needling sessions at 6 to 8 weeks intervals is usually recommended to achieve optimal results. However, great skin improvement is notable just after the first treatment. Clients are also encouraged to use a derma roller or a derma stamp in between their skin needling sessions to enhance procedures and the results. Now, remember what I said was the home use needles do not penetrate the skin. So make sure your clients are not doing this on their skin at home. They are not estheticians and they are not licensed professionals. Pre and post care. Avoid sun exposure 24 hours prior to treatment. Discontinue the use of retinols 12 hours prior to treatment. You should not have any active breakout, active cold sores, or open lesions. If this occurs, your microneedling treatment should be rescheduled. Wait 6 months following Accutane use. We don't do any facials, any waxing, any facial services within that 6 months of stopping. It's going to be after that 6 months because the skin is very thin and very sensitive. Wait at least 48 hours before or after Botox treatment to have a microneedling treatment. Because you've had injections in your face, there is injection sites, okay? So we don't want to go over those injection sites. 1 week before or after any fillers, such as Juvederm, Restylane, or 1 month before or after laser treatments. We need an intact epidermis, a healthy skin, and a healthy client. Only use the mild products for the next 24 hours, like a gentle cleanser, a gentle moisturizer, a hyaluronic acid, definitely a chem-free SPF. Day 2 through 4 post-procedure, use a gentle cleanser and a chem-free sunblock, as well as continue using daily supportive skincare. Avoid exercise for 3 days following the procedure, and no sun exposure for 3 days. So we really want to make sure that we don't do this on the week of a special event, and that they're not going away, and that they're not going to be in the sun. Combining services. Of course, I talked a little bit about the vampire facials, the PRP facials, but you could also do microneedling and chemical peels. You could also do LED, sheet masks, combined with cooling ice globes, all right? But it's very important to do a skin analysis, client consultation, and consent forms. Now, the chemical peels and the microdermabrasion, I recommend you alternate your chemical peels and your microneedling. However, whatever device you choose, you will go with the manufacturer's guidelines. Whatever chemical peels you're using, of course, you can check with that lab, that manufacturer, can you combine these with the chemical peels? Likewise, with any serums you're using for your slip and glide over the skin or using afterwards, make sure that that serum can be used in combination with microneedling. Liability and insurance. I said to you in the beginning, really check with your state board regulations. Is this under your scope of practice? Does the state board allow it? Do you have the correct licensure to perform this procedure? Do you have liability insurance that covers you for microneedling? Do you have a medical director? Are you falling under his license, or are you working in a medical office with a medical director present? And are you covered under his liability insurance and under his licensure? These are all questions you should ask before you start microneedling procedures. Again, every state is different. Why do I love NASNPRO? I think what I love about NASNPRO is how we connect with estheticians and spa professionals from all over the country in a very intimate setting. When you go to spa shows and trade shows, which I love because it's fun, the education is there, it's fast paced, there's lots of booths, but this is very targeted, focused education so that we're able to connect with the therapists in their state, spa owners, spa directors, and we're able to support the therapist with education and networking on a very individualized basis, which makes us a stronger community. I really believe we're stronger through education. I believe that the medical fraternity in our community takes us seriously through licensure and education and professionalism. I believe in spa excellence with a combination of professional ethics and skills. Learning skills today that you can put into practice tomorrow is what advanced education is all about. NASNPRO has been able to bridge that gap, giving our esthetician community a place to learn and thrive together. And isn't that what we need during these times? I'm Elaine Sterling. I'm, as I told you before, an esthetician instructor. I own Elaine Sterling Skincare, and I own the Elaine Sterling Institute in Atlanta, Georgia. We have an esthetician program, nail care program, cosmetology, and massage therapy. We have over 400 students in a beautiful space inside Lenox Square Mall in Buckhead, Atlanta, where it is a college-like campus. It was always my vision to have a college-like campus that raised up the therapist, the licensed professional, and gave them a place where they could really learn their foundation and hone their craft and be taken seriously and take skills that they learn today and put in the treatment room tomorrow. So I really want to thank you by listening to um, this little class today, this mini class on microneedling. Even if you don't do microneedling, I hope it's given you some insight and some questions to ask your client or some of the microneedling manufacturers of which way is the best way for you to go to help grow your business. So let's talk about an instant door prize. So, product information. The first person to respond in Facebook thread wins. So here we go. I am going to ask you a question. In 1995, who was the South African plastic surgeon that really created the small needle stamp to induce collagen therapy? Who was that that trailblazer, that South African trailblazer that really put microneedling on the map? And the first one to respond in the Facebook thread wins our brand new face and décolleté lift that has probiotics, peptides, hyaluronic acid, and vitamin A. This was so fun. I look forward to seeing you, and I can't wait to send you your incredible prize. And I cannot wait to support NASNPRO in the future. And if you're ever in Atlanta, I'd love for you to stop by the school and come see me. It's always wonderful to chat and hang out with other licensed professionals and students and help support you in your vision for your future. Bye. Thank you.